If you're on any kind of HRT with an estrogen and you're wondering if you're on the right thing, this is a video for you because we're going to be talking about oral versus transdermal estrogen. So this is the difference between taking your estrogen as a pill versus taking it as a patch or a gel or anything that's absorbed through the skin, which is a transdermal estrogen. So if you're taking it as a pill, that estrogen is being processed by the liver before it goes on to do everything that it needs to in your body, which is not the case when you're using a transdermal estrogen, a patch or a gel. It's not processed through the liver first. What's the difference? Well, you may have heard that if you take an oral estrogen, there's a slight increase in clotting risk. So if you have a history of DVTs, blood clots in your limbs, if you have a history of strokes, anything like that, then there may be extra consideration for an oral estrogen because that would slightly increase your risks. However, that is completely bypassed with a transdermal estrogen, which is fantastic. And that is, to my mind, the biggest difference between the two and the biggest reason that I recommend a transdermal estrogen primarily for my patients, unless there's some reason they can't or there's some other reason. I generally would recommend a transdermal estrogen if it's possible because you lose that clotting risk, which why not decrease risks if we can. It's not a huge risk and the benefits vastly outweigh the risks for the vast majority of people, but if there's no reason not to have transdermal, that's usually my preference when I'm prescribing for patients.